Hippocrates once said that our food should be our medicine and our medicine should be our food. And of course what he meant by that was that food is critically important to a patient's capacity to recover. As nurses, we're trained to recognise the importance of nourishing our patients, many of whom are malnourished when they come into hospital or by virtue of their illness. So encouraging patients to eat, giving them the capacity to eat well, helps them to restore their powers of recovery. And that's hugely important from a nursing point of view.
This training toolkit to me is one of the most important things that we can have. We've got varying practices across all of the different hospitals for how patients have their meals. What we want to have is standardisation.
As a department, we wanted to produce a perfect meal toolkit to help ensure that all patients receive a perfect mealtime and to make sure that patients' safety and dignity and that their quality of mealtimes is maintained.
So this video has been devised to help patients and most importantly staff and carers to assist patients to consuming their meal in the correct way, in the best environment to enable them to maintain their nutrition and better still, enhance their powers of recovery and healing.
As part of this toolkit developed by the Trust Nutrition and Dietetics Service, 6 golden rules for mealtimes have been identified. These are communication, assessment, preparation, delivery, observation and completion. This film will demonstrate to you best practice and showcase how each and every meal should be served. The perfect meal begins with how every ward and department across the Trust is set up for mealtimes.
Protected mealtimes are a national incentive and they're something that we strive to work towards. What it means is that there can't be ward rounds on a ward at that point in time, so that you won't come and see a patient for something that's routine. So somebody won't have blood taken, they won't go for a routine x-ray. What we want to have is that the meal times are there for the patient to concentrate on the food that they're eating.
Protected mealtimes start 15 minutes before the meal is to be delivered. This is done by the mealtime coordinator who will ring the bell so that everybody else who is not involved within the mealtime can vacate in the ward.
Morning, Fred.
Oh, morning.
Morning. My name is Sophie, and I've seen you haven't filled your menu. Do you need any help?
What the nurse should always do first off is introduce themselves. Everybody has the right to know who they're with, whether they're being cared for by someone in direct patient care or whether they're being helped to have a meal. So they need to say, hello, my name is, so that we know who that person is. They then need to make sure that the patient's comfortable. So do they need to go to the toilet? Do they want to wash their hands? Do they want to drink? Have they got a dry mouth? Then where do they want to eat? Not everybody wants to eat in bed. Some people don't mind. Some people would like to get help to get out into their chair. Then once they're there, do they want to be fed or do they want to feed themselves? If they need to be fed, does something need to be done to protect them? Do they need aprons? And we need to pick this up and we need to find out and have it documented. What we then need to do is make sure that the patient is happy with how they're being fed so that when they've got their meal, you say, do you need any help? And keep checking and making sure that the patient can make the best of the meal that they've been given.
It's vital that the nursing staff and the housekeepers on the wards coordinate well together during the meal times to ensure that the delivery of the food is swift so the patients get it nice and hot. So everybody should be involved in that unless you're a nurse who is administering the drugs to the patients, because that will happen at the same time. Dietitians will be part of that team potentially so that they can advise on the correct menus and the foods that the patients might require. And then we also have the doctors who can assist us with prescribing certain drinks.
It's everybody's responsibility to ensure that the patient has the perfect meal. It's important that the table is set up correctly before a patient is served their meal. This is to make sure that everything is available for them, to make sure that there's nothing cluttering the table, books and everything else is removed, and just so that it's a clean environment.
Protected mealtimes are part of communication. Signage at the entrance to the ward or department tells staff and visitors what times meals are served. The ringing of the bell to signal the start of protected mealtimes is part of preparation. Preparation also means everyone involved in mealtimes are aware of their roles and responsibilities. All patients are given the opportunity to choose their meals from the Trust menu.
If patients have particular dietary requirements, maybe they need pureed meals or they have a special diet, that should be documented at the start of their nutritional care bundle.
The menu has lots of different options available to the patient depending on any conditions they have or any special food intolerances, allergies or meal choices. There's a special symbol like a heart for healthy eating, there's a V for vegetarian meals, there's gluten-free meals available, soft mash meals, and we also do modified consistency such as puree diets.
We've also got options for snacks. Snacks for us are really important as dietitians because when patients need slightly more calories, they're a great way of getting something extra in. So we would be looking at things like a piece of cake or a scone, and they're the things that we want patients to be able to have freely available to them.
On the menu there's 3 different options: small, medium or large portions.
Portions are really important to us, that if someone ticks small, that they get served a small portion, and there's more chance they'll eat that. If they eat the whole small portion, nutritionally they've done better than being given a big portion and pushing it away and not eating anything. So portions are really important to us.
We're introducing finger menus as part of our dementia strategy. We find that dementia patients actually eat better if they can eat their food with their hands. So we're adapting this from the normal menu, so we've got a wide range. It's not just a few items that will be available, it's a wide range of items.
We also want to open it up so it's available for the children's ward and any other patients that we gather information from their family or from themselves that they're not managing so well with knives and forks and spoons. So people can have warm food or cold food, it's not just sandwiches. And that people can eat food that they can feed themselves, so get the best nutrition out of their meal. So they might not need nutritional supplements. What we're trying to do is make mealtime the best for every patient.
All patients undergo an assessment on arrival in hospital, and this should be documented as part of their care plan and bundle. The completion of the menu is an important part of the communication process. Menus should be completed in advance by the patient or with assistance if necessary.
At the start of the mealtime, they bring round the starters first to the patients, then that's taken away. They then confirm that they wanted the meal that has been ordered. That is brought to the patient so they can eat their main course, and then that's the same again with a pudding. And then at the end of the meal they bring round a tea trolley, so they're offered either tea, coffee or a cold juice drink.
Hi Fred, my name's Megan. I brought you a roast beef dinner that you ordered.
Oh, lovely. Aye, that looks nice, thank you.
Hope you enjoy it.
Thanks.
Bringing courses in individually gives the opportunity for the patient to take time with their meals and eat them, and they're not overfaced by food. If you've got a lot of food in front of you and you've not really got an appetite, then that really does make you struggle, and you think, oh, I've got to get through the next course and the next course. Whereas if it's brought to you as one course at a time, then they can face it a lot better and hopefully manage more of it.
Meals are interrupted when they need to for a patient's care. So you would interrupt a meal to come and take emergency blood, to take a blood pressure, to check on a patient who's unwell. If a patient's rung their buzzer if they're feeling unwell, what you wouldn't do is interrupt that meal time to take a patient for a routine test or a routine scan.
Hi Fred, you're just waiting for an X-ray. I'll just move the table. Yeah.
You wouldn't have a general ward round going on. You wouldn't have somebody being assessed by a physiotherapist or a dietitian. That's the time for the patient to have their meal. So we protect the patient's meal time for everything other than the emergency cases.
Jenny, afternoon. It's lunchtime.
Oh.
Yeah, it's lunchtime.
Oh.
Do you want me to put your bed up?
Please.
Yeah. I've got your glasses here.
Assisted meals are for patients who can't manage to eat by themselves. It may be due to a wide variety of different health conditions.
Okay. I'll just move the table to you so that it's comfortable.
What we need to do is make that table be the best for a patient to eat from. It needs a knife and fork on it. It needs to have a tray that's the right colour. What we do is we highlight if a patient needs extra support with a red tray as in the trust. We then also have crockery and cutlery that's friendly for a patient. So some food is easier to eat off because of the way the eye sees. So if you have dementia, it's easier to eat off yellow crockery. And these are things that we need to make sure we have highlighted, and then that's how the patients serve their food.
Hello Jenny, it's Sophie again. I've got you some food. Do you need some water?
Yes, please.
All right, I'll just pour you some water.
Thank you.
Patients will be assisted by, it could be a member of their family, or it could be the nursing staff, and that's just to help them eat and help maximise their nutritional intake.
Come on Jenny, have another spoon. Do you want to try
No.
one more? Do you want a drink?
One of the real common errors is trying to feed two patients at the same time, and that's just not going to work. So someone between two patients with 2 meals and 2 spoons. So the patient doesn't get their attention, and everybody deserves the ability to have their meal and have that attention. So that's a big problem. Another problem is 2 people sat side by side chatting and ignoring the patient, so that you're having a conversation and just feeding the patient, and the patient's getting no interaction. Now, food is social. We know it's social, and we know people eat better when they get that opportunity to have a social time at mealtime. And that's one of the real problems. The other one that's often in the news is patients can't reach their food. So there is no point in giving a patient their meal on a beautifully cleared tray and it being at the end of the bed and they can't get to the end of the bed. So you need to make sure that the patient can actually reach their meal as well as feed themselves.
Delivery of the perfect meal is important. Courses should be served one at a time. Patients shouldn't be interrupted for routine tests or assessments, and mealtime should take place outside of ward rounds. Some patients need assistance and observation at mealtimes to ensure they're eating the appropriate foods and the right amounts.
What we do as a trust in County Durham and Darlington is for every patient that has a moderate nutritional risk, they have a nutritional bundle. What this means is that they have nutritional nursing documentation, and then they trigger a 7-day record of everything they've eaten and drunk. So at the end of the meal, it's really important for somebody to write in the amount that a patient's had. What we can then do is look at their weight as it changes every week, see if we need to change any of their nutritional supplements, and equally see what's happening. We start to get a picture of foods people might like, if they're working better on different portion sizes, and if a different menu's better. We might notice that a finger food menu might work better for someone. So it's vitally important at the end of a meal to get that information documented.
The records should be maintained as soon as possible so that we all are up busy and we can get distracted, and sometimes we can forget what the patient's actually eaten. So it's important to get that meal documented on the food and fluid monitoring bundle as soon as the meal is finished.
A simple measures cup is a new cup that's been developed. What it has is inside it a little chart, a little bit like a graph, with a number of mils on it. Now the idea is that you fill to the fill line. Then as a patient drinks, the numbers start to appear. So when at the end of a meal the nurse or the healthcare assistant is documenting what someone's eaten and drunk, you can see clearly what they've had. The problem that we have with normal cups and glasses is we try to give a visual guide of a half glass might be 75 mils drunk, but it's all guesswork. And in the simple measures cup, it will tell you exactly how much has been taken. And so that you can get an accurate idea of oral fluid intake for a fluid chart, which can really help with a patient's medication and their improvement in symptoms.
On admission to hospital, patients are screened for malnutrition using the MUST tool. If a patient has a score of 1 or above, they're started on the nutritional care bundle. For any patients who have a MUST score of 1, they'll be automatically started on a Complan ready to drink milkshake, and this is to help supplement their nutritional intake. If a patient has a MUST score of 2 or above, they will be started on Fortisip Compact or Fortijuice, depending on which they would prefer, twice a day, and this is prescribed by the doctors, and the patient will then be referred to a dietitian to assess their nutritional status.
Some patients have nutritional supplements because they can't manage to eat enough to meet their nutritional requirements, or because they've lost weight and they need extra nutritional requirements. The problems that we can have with nutritional supplements is when they're given warm. We know that they're much better to be given chilled and in a glass. So it's really good if we can have them decanted into a glass and if they're cold from the fridge. What's a common problem is that they're just put on the end of the bed, patients can't reach them, and they get warm. When they're warm, it's drinking warm milk, which a lot of people really don't like to have.
we have our nutritional care bundle. At the back of this care bundle there is a tear-off booklet. This is given to patients by a member of staff. It could be a nurse or a dietitian or a doctor prior to their discharge home, and it gives tips for maintaining their nutritional status when they go home.
On completion of the meal, food intake needs to be documented and records maintained. Tools are available for staff to help monitor this, including the simple measures cup, and nutritional supplements may also be necessary. These records help with ongoing assessment.
At the end of the meal, the nursing staff will remove the trays. They'll also complete the food record charts, and they'll ensure that the patient is placed back into bed, or if they wish to be left to sit in the chair. And it's important to make sure that patients have their mouths wiped and are comfortable.
The 6 golden rules for the perfect meal have been developed by the Nutrition and Dietetics Service in order to help our patients make the speediest and best possible recovery.
Hospitals are frenetic, busy environments. They're entirely ill-suited to giving patients a good meal experience. There's too many people around, too much noise, too much distraction. So food is very, very important, as is hydration. And it's important that we create a special place in the patient's day to give them enough time, resources, capacity, assistance to eat well.